Hello everyone, I am Dr. Krishna Garg. I was Professor of Anatomy at Lady Hardinge Medical College. Today I will talk about BD Chaurasia's Applied Anatomy and Physiology for Nursing Students, which is an integral product of the best-selling BD Chaurasia's Human Anatomy for Medical Students. BD Chaurasia's Human Anatomy was published in 1981 in 3 volumes, which was expanded to 4 volumes in 2016. These volumes have simple, lucid language and line diagrams. They have been extremely popular for medical, dental, physiotherapy, homeopathic and Ayurvedic students. For the last few years, even nursing students were gaining knowledge from these volumes. So it was decided in late 2020 to make BD Chaurasia's Applied Anatomy and Physiology. By Almighty's blessings, the single volume got published in late 2021 and is doing well so far. This volume is textual as well as digital. Overall features of BD Chaurasia's Applied Anatomy and Physiology. This volume has been compiled and reviewed by eminent and selected medical and nursing staff from all over India. These persons have done an excellent job to make the volume very useful for nursing students. This is the first volume as per latest syllabus of Indian Nursing Council. The volume has a unique amalgamation of anatomy, physiology with relevant applied aspects. Nursing implications and applications are included. The book is written in most simplified and lucid language. The overall features are 10 units with 20 chapters, 4 appendices, 30 dissection images, 1000 illustrations and images and tables, 500 important terminologies, 50 histological slides, 20 animated videos, and 20 chapter-wise assess yourself exercises. They are unsolved in the book, but complete solution is there in the app. I hope you like the feature of Chaurasia's Applied Anatomy and Physiology. Each chapter of the book begins with learning objective, chapter outline, key terminologies, high yield points, recent advances, extra edge, nursing implication and application, aging changes, tips to keep the system healthy and assess yourself. Some special features are: each chapter of the volume has a unique amalgamation of anatomy, physiology with relevant applied aspect. The figure shows anatomy of thyroid gland with clinical figures of thyrotoxicosis and myxedema. Our aim for this book is to emphasize the clinical conditions prevalent in our country, that is, tuberculosis of lungs and other organs. Nursing applied aspects are the use of intramuscular injections in the deltoid muscle. During COVID, vaccination had been given in the deltoid muscle. Such injections can also be given in the gluteus medius muscle as well. Effect of age on functioning of the system during childhood, during adulthood, and during old age. Tips for a healthy system are fresh, nutritious food, yoga, walk, meditation. It is said, early to bed and early to rise makes a human healthy, wealthy and wise. Further, each chapter shows the sequence of events in the form of flowcharts which are easy to understand and recapitulate. Each chapter contains many simple, appropriately colored, labeled diagrams. One should practice these diagrams 2 to 3 times to be able to reproduce them in their multiple examinations. As is well known, Each diagram speaks 1,000 words. At many appropriate places, histological diagrams are given. These are stained by hematoxylin and eosin. It helps everyone to understand the physiology of the subject. Some of the clinical dissection photographs are given to give them a feel of dissection hall. One has to assess oneself by using various means. These are long questions, short questions, image-related questions, multiple choice questions, fill in the blanks and match the terms in the two columns. Appendix shows tips to memorize, that is mnemonics. She looks too pretty, try to catch her. And vein, artery and nerve in the costal groove. For the first time, we have introduced the hybrid edition for making learning innovative and simplified. Let's now walk through the digital platform. Now there is a journey through digital features.
Before taking you all through the chapters of the book to show each integrated hybrid feature, let's first understand what is this hybrid edition and its concept, and how it is useful for you in your learning journey of applied anatomy and physiology. Hybrid edition, if we say in easy term, is basically a book along with its digital support. Hybrid learning is a blended learning wherein the printed books are thoughtfully integrated with the digital support to reconceptualize the teaching learning process in the form of digital learning in more interactive manner and added values to knowledge. This hybrid endeavor is to facilitate the next level preparation of nursing examination with the allocation of more practice tests, more audiovisual aids, more quality content, more flexibility of learning anytime, anywhere, all in engaging interactive learning experiences. Let's see how the new era of learning, that is the hybrid edition, will be beneficial for you. You will get the complete book in the palm of your hand. It is the most simplified and interactive way of learning. It is a portable and quick learning resource that is the time-saving approach. You can access the content anytime, anywhere and revise content on the go. It gives informative format with consistent expert guidance. It makes your study smart by giving substantial integration of content in book and in digital edition. It is comprehended with the digital tool that is the 3D real-time visualization of human anatomy and physiology. And you will get time-to-time recent updates. Let's start from the start and explore the unique conceptualized feature that are integrated with the book chapters. The very first feature is Listen and Recall section. This feature is exclusive for the digital support, covering chapter-wise golden points in the podcast form, so that you can summarize the whole chapter.
Chapter 1. Brief Introduction of Anatomy and Physiology. Anatomy and Physiology. Brief Introduction. Anatomy is the science of learning the normal structure of the human. Physiology deals with learning and understanding the functions of the body. Cadaveric anatomy, where study is done on dead or embalmed or preserved bodies. Regional anatomy, in which the body is studied in parts like the upper limb, lower limb, thorax, abdomen, head and neck, and brain.
Moving to the unique super feature that is See and Perceive section, which showcases 3D animations to make complicated topic easier in engaging and interactive manner. The whole book has 1,000+ illustrations from which important 100 3D animated models are given in this section, with the proper labeling and proper description to give real-time experience. From these 100 animated models, get 20 plus animated videos that are integrated, clearing your basic concept.
Two flexor surfaces are brought close to each other. It is called flexion. Straightening of the arm and forearm at the elbow joint is extension. When limb is taken away from the body, it is called abduction. And adduction is when limb is brought close to the body. Circumduction is movement of distal end of a part of the body in circle. Similarly, the lower limb movements help in keeping the organs fit and flexible. When thigh is turned medially, it is called medial rotation. And when thigh is moved laterally, it is called lateral movement. Raising the medial border of foot from the ground is inversion, and raising lateral border from ground is eversion.
Let's move to the next feature, which is high yielding topic section, especially for your revise on the go. Now, no need of carrying book every time. This section covers dissection images, nursing aspects, images, flow charts, tables to support the theoretical concept at your fingertips for quick reference. Key terminology in the book has been covered in the Read Manually and Search Digitally section, where you can make your every digital touch count by searching 500 plus key terminology with their meaning in searchable format. Coming to the next aiding feature, that is the Assess Yourself section, which is basically read from the book and practice from the app. Hence the name Read and Practice. It covers solved exercises from the book with briefly explained rationale and some exclusively covered MCQs, variety of exercise for more and more practice. And you can assess yourself with the scorecard generated after every test. Stepping on to the another feature, that is the add-on section, which is Dil Mange More content. It gives additional content in the form of appendices, previous year paper, study tips, mnemonics, 50 plus histological slides important from nursing perspective, along with its 3 identifying factors. Last but not the least, the significant feature, that is the recent update, which provides all the recent advancement in the field of anatomy and physiology in regular interval. Hope you have liked the innovative ideas introduced by CBS publishers of bringing nursing titles in hybrid edition.
Comparison of the volume of book with the digital work. Volume shows 2-dimensional diagrams. In digital, we see 3-dimensional animation diagrams. The book is cheaper, digital work is costly. We need only book, whereas for digital we need mobile and computer. Diagram speaks 1000 words, whereas animation and video speak 10,000 words. Text and hybrid versions are complementary and synergistic to each other like a friendly handshake. E.D. Chaurasia's Applied Anatomy and Physiology hybrid volume is a new hope and inspiration. Thank you for the patient hearing. We need your feedback and full support. Thanks a million. God bless us all. Thank you very much.